Well, welcome everybody. This is Patti Webster with the Conversation Project. If you have joined us a little early, you have been privy to the motley crew that's here with us today. And we've been so excited to see all of you joining us on our attendee list, so welcome. I'm the lead for community engagement. If you're not sure who I am, I've been on these calls multiple times. If you've been with us, if you haven't, I help lead our community engagement for the Conversation Project, and will help lead this call with you all. So this is really an open sharing call. It is time to gather together and learn from each other. We really thank you for joining us during this time, because we really know that this is quite an unsettling, hectic time for all. Our heart goes out to everybody, because we know that each of you have been reaching out and helping those in your sphere, personally and professionally. So I want to thank you for taking this hour to join us. And as you can see, this is an hour that we really hope will give you a break. Help you get we are hearing and seeing at the Conversation Project and across some of our wonderful partners, and hear from you and hear what's going on in your neck of the woods. So I'm going to give us a little bit of instruction before we jump in, and I know we've got a really good number of folks on the call today. For those not familiar with WebEx, and if I am speaking too fast, give me a shout. This is a platform that many may be comfortable with. What I want to just point out a few things is that for audio settings, later on we're going to open this up. We're going to ask folks to raise their hand if they wish to be taken off of mute. We'd love to hear from you. We want to hear from you during chat throughout the call. For those that might be interested in speaking up, click on the audio settings, and you have to make sure that you have audio settings available. It may be on that bottom button. If it's not on that bottom button, for me, on the top under Communicate, there's a bar right up top. If you click on Communicate, go down to Audio Connection, that will help you connect your audio. So that is the one. Chat. So if you take a look at the bottom right-hand corner, you can see a lot of the chat already happening. If chat is not on your screen, if you see that bubble button where all right, right.
Christopher just highlighted it.
Oh, thank you. My arrow is not working. So if you look at that open chat right there, click that, the chat will pop up so you can have a go. We want you to talk with each other as well as talking. We know you guys can multitask because we've seen you do it daily. The third thing is when you do chat, look at that right-hand side. If you click to all participants, so we all can see what's going on and we can share and learn together. If you do have any audio or technical difficulties, Christopher's here. He's hosting this and he'll help you out. You can get to him directly by drop down and look for Christopher. If not, if you pop it in there, we'll definitely see it. So I hope that gives you some orientation to the webinar platform. And again,
yeah, and can you go back 1 second, Patty?
Yeah, sorry. Yep.
I just want to highlight something extra because we're going to use this in a minute. We're going to use the annotate button to kind of indicate where you're calling in from. And so when we do get to that, this here on the left-hand side of the screen, that's how you get to the annotate menu so that we can use the arrow later on.
Super. And actually, while we are there, the other thing on here is there's a raise your hand function, which should be over on the chat, right above the chat box. There is a raise your hand function. So if you want to speak at some point later when we open it up, you can give us a little holler. That'll be helpful because we do have a lot of participants in the call today. Christopher, anything else with that?
Yep, I think we can go ahead.
Awesome. So this is our Conversation Project team. You'll see Kate at the very top. We'll hear from Kate today, our director of the Conversation Project. Along with Kate and myself is Christopher. Yoshi up here on our video. Katie Mirny is hidden, but she is our team making sure we are all connected via chat. She's going to keep an eye on what's going on in chat, pull up some questions, and help us with discussion. So that is our team. Before we go to the next one, so I'm going to get us a little warmed up with the chat, and then we're going to jump right into the content of the call. But let me just point you over to the chat right here. And I thought we would start just slowing down. You've taken an hour out of your day. We appreciate it. There's so much going on right now, so we thought we would have a little reflection and start with a pause to reflect in the chat button. So let me pop open a question that I'm going to ask you to answer in chat. And thank you. You guys can keep popping in your names and who's on the call. That would be super. I'm going to ask you in the chat box, think about what is one word that's causing you concern about the COVID-19 pandemic. So think a little bit about that. Is there, if you can hone it down in one word, what would that one word be? I see a lot of uncertainties, family, isolation, loneliness, panic, unknown, dying, vulnerability, yeah. Fear, uncertainties popping up a few times. Misinformation, absolutely. Income. Great, thank you all. So you can see there's a lot of common threads as we think about what is bringing anxiety to us. So I want you to now shift directions. And I want you to think about the other flip side of this. What is one word that's causing you hope about the COVID-19 pandemic? Right. See a lot of communities and connections, togetherness and laughter. I love this. Family, unity, flattening the curve. Great. And you can keep popping that in there. And we are really hopeful. We know at this time, sometimes it's unsettling, but we know that when we're in a time of unsettledness and change, there's a lot of good. And I love, this is really warming my heart to hear some of what you're sharing. We often, as a team, we kind of go to our comfort zones and what brings us comfort. A lot of what brings us comfort are familiar faces. And so today we are really excited to bring our familiar faces and incredible partners here today to share some of their experiences on the call. We have Anna Gosline from the Massachusetts Coalition for Serious Illness. In addition to leading Blue Cross, Anna has many hats, and she's been a phenomenal partner and leader in messaging and engagement. So we're excited to have Anna here. We also have Mariset Hassan. Mariset has been a long-time champion and endless advocate for change. And Mariset is coming to us from South Carolina through the coalition there, through the Carolina Centers for Hospice Care, and they have phenomenal community work on the ground, reaching those particular vulnerable populations as well. Mariset, we're excited that you're here as well. And of course, Nathan Kontkamp, you all know him from National Healthcare Decisions Day, our founder for National Healthcare Decisions Day. And so we're just really heartened to have you all with us today. Again, we are also really heartened to have everyone who's been typing in on chat. We have about 220 participants so far, and we're really excited. And so we want to know who's on the call. So we're going to use that map function. As Christopher mentioned, we've got over on this side, if you click this little squiggly line, you'll see an arrow. If you click on that arrow up to the upper left-hand side, you'll be able to take your arrow. We'd like you to pop on where are you located on this map to give us an idea of where, and I apologize for those that may be outside of the United States, and we know this is not necessarily geographically correct because Hawaii is not that close to Texas, but go ahead and pop your arrow in. And please also feel free as we go along to let us know who is here in chat. So pop your name in, let us know if you're affiliated with an organization, go ahead and pop that into chat as well. So I see this is fantastic. We have representation all over East Coast, Midwest, West Coast. I know I see a bunch of folks in Alaska. I don't know, Erin, if you're in sorry, a bunch of folks in Hawaii, and I don't know if that's Alaska or not. But I'm just really excited to see all of these familiar faces. I see a lot of really phenomenal champions, and we're excited to hear what's going on. So let me keep going and popping in those introductions. If you see a familiar face, you can chat with each other in the box. You know we're casual because you heard us chatting at the beginning of this call. We're hoping this will be an hour full of sharing. So without further ado, let me pop the quick agenda here. We are going to first start off with sharing some new resources available that you may have seen already. Kate's going to walk us through a little bit about what we have and things to keep your eye out for. And we're going to open it up and hear some takes from Anna, Marisette, and Nathan on messaging in current climate and repurposing National Healthcare Decisions Day, just given everything that's going on. Then we're going to hear some examples of what we've heard and really open up discussion, pull some of you in, hear what's happening in your neck of the woods, any question and answer that you guys have, and that will bring us to the end of the hour. So without further ado, Kate, I'm going to pass it over to you.
Great, thank you so much. Just want to confirm, Christopher, you can hear me okay?
Yes, indeed.
Okay. Well, hello, everybody. It is so nice to see so many familiar names and friends here on the list. We're really glad to be with you today. And just wanting to jump right in, as we were saying, there are so many webinars happening, calls, groups getting together, a lot of state coalitions, and I know that nationwide we're seeing an increased interest in this concept of advanced care planning. You can see the number of people on the call today with less than a week's notice. We've seen a lot of increased traffic to websites, downloads of materials, media requests, and I feel like many of you are starting to feel the same or seeing the same thing. And so just wanted to share with you some of the new resources that we have for you as we think about framing in this era. I know many of you had already planned National Healthcare Decision Day events and have been thinking about how to or whether to move things to virtual formats or other setups. I think you're going to hear some repetition of concepts across speakers today, and I hope that you'll take what feels best for your community, knowing the audience that you're trying to serve. And I think that, like, as you know best, planning for these conversations or the type of care someone wants towards the end of their life is something that almost everybody knows they should do and thinks is important, but it keeps dropping to the bottom of their urgent to-do list. And now the pandemic has really bumped it up, made things feel a whole lot less hypothetical for folks. And I think that's really why we're seeing so much interest. And people, members of the media trying to wrap their heads around this for the first time, or how do you focus on messaging that doesn't do damage to the great work we've been doing, really recognizes the fear that people have right now. Knowing that a lot of folks are feeling a loss of control over so many areas of their life, and that we can't control how this pandemic plays out, but we can try to help people realize that they can control who might speak for them, if they can't speak for themselves, how to make sure people know what matters most. And what we recommend in many ways is still the same. So you can see here on this slide, we have a new guide that the Conversation Project and Ariadne Labs just released. It's a free 2-page guide to help people think through this. We have it in English and now Spanish up on our website. And the gist of what we're sharing with others kind of captured in here, and messaging that's hopefully helpful for you. Number one, don't pass go. Stay at home, work to avoid getting the virus. That this is something that people are really concerned about, getting into all the legal, medical technicalities. But one of the best things we know we can do if people are concerned is to really do as much as they can to do social distancing, follow those recommendations. That's one of the most important steps, and we lay that out in there. Then to help people pick their person, whether in your state that's a proxy, an agent, a surrogate, whatever that is. If you get sick, who would you want to speak for you and help make decisions if you can't speak for yourself? And I think right now a key thing that we're seeing is even if you can't get that formalized or documented legally, I know, Nathan, you're our legal advisor, you can tell us if this is wrong, but still picking who that person is, having a conversation with them, getting on the same page is critically important. It doesn't have to always be the oldest, a family member or the oldest child or your spouse. We share a lot of these tools with people. We have our guide on how do you pick a proxy, but this is a time where I think a lot of people are figuring out, oh boy, who's my person going to be? How do I pick that? And so we can help point them to tools that already existed before this. And to then really focus on talking about what matters. You guys are all PCP champions, so you know how to do this. How do you get people to think about what good days look like, what they're most concerned about? Are they wanting to pursue aggressive curative treatment, aggressive comfort care? Especially if you have a serious illness, how can you talk to your doctor? Think about what some of your risk factors might be, how to push that forward. And one of the things that I would add, it's not actually in this guide, but I just mentioned it to you guys, is after somebody's picked their person, had their conversations, maybe talk to their doctor, is to tell other people about that. Who is your proxy? How can we head off challenging dynamics within families and friends where people are in disagreement about who the decision maker should be? You don't always have to have in-depth conversations with everyone, But if everyone knows who's on point, that can really help. And I remember an example that we share often of a woman in Florida who was the proxy for her husband in his second marriage. And his adult children didn't know that she was the decision maker. And just by giving them the heads up, he helped stave off a whole possible turmoil if his health situation got worse. So I think that's another key thing, is not only pick your person, but help other people know who you've picked and that you had conversations with them. And the other thing that we're really hitting home for people is, even if you already have an advance directive or a proxy, it is a great time to dust that off, review your wishes, explain it again. You know, these conversations really help clarify, particularly when we have this scenario to think through with the pandemic, and it doesn't do us much help to have something sitting in a manila folder in a desk that family members find months later. So even for people that you work with who you feel like you're preaching to the choir and yeah, I've done that, really encouraging them to think through things. We also have a page with additional resources, like how to help manage stress, how to support older adults and family caregivers, how to talk to children. So we've just been collecting resources that we think are helpful, that other groups have started to put together, and are keeping that on our COVID-19 page. We'll make sure that we get the link to the page to you in the chat. And we've also set up a Facebook group for Conversation Project Community Champions so that we can be sharing tools and ideas more rapidly. My one request would be, there are 3 entry questions when you try to join this Facebook group. Please answer them. We've had a lot of people try to join the group and they don't tell us anything about themselves or how they're how this is applicable for them. So just really want to invite you to do that. Those are some of the things that we've been working on, along with setting up this call, talking with the media, helping support different community leaders like yourself as you're thinking through different programming that you might be doing. And what we really want to do now is turn it over to a few guests so that you can hear a bit about how they're thinking of messaging, especially during this National Healthcare Decisions Day month. You know, this was the month that there were going to be thousands of events happening in person. And so in many ways, we're well prepared. We had programming, we had messaging in mind, and thinking about how to repurpose that now, I think will be really helpful. So with that, I think we're going to turn it over to Anna, and let me get you over to Anna's first slide. Christopher, you can give her control, and Anna, don't forget to unmute yourself.
Can you hear me?
Yeah.
Sweet. Okay, thank you so much, Kate. And it's so amazing to see 247 people kind of collected together to talk about this. It's such a challenging time. I think, you know, so the Conversation Project is one of the founding members of the Massachusetts Coalition for Serious Illness Care. So, you know, it is one of the reasons why we are very fortunate to have an organization like TCP in our backyard. And for the past sort of 18 months, and you guys might have joined previous TCP calls that I've been on, where I've been sharing some of the messaging research that we've been doing. And it really started, you know, a couple of years ago with our coalition, which is about 110 organizations in Massachusetts, saying, you know, it feels like we want some new tools to gain new insights into how to communicate to people about the value of advanced care planning, how to talk about it in new ways. And so we sort of started this messaging research project. And the culmination of that was going to be, and if you'd heard this me talking to this group before, was going to be this campaign that we were kicking off in April. It was a Good Talk campaign. There are these beautiful posters. We did photo shoots. We did activity cards. We did all these fill in the blank, and we were doing a lot of trying to move that conversation upstream, given new insights that we found throughout this sort of multi-phase consumer research project. And one of the hopes was that we started trying to sort of seed in people's minds to think that shared decision-making and the kinds of conversations that we want to happen at the end of life should actually be a lot more part of all of your healthcare interactions, and really start getting people to sort of normalize this in a different way and try to think about these new ways to sort of get people to understand that they should ask for this in clinical settings as well. But that all got scrapped. As we were putting together the sort of social media buys to try to put, you know, paid Facebook ads to understand, sort of test this language in practice, just realizing is that this is sort of a month ago, which seems like a lifetime ago in COVID time, I'm sure it all does for you, that it just wasn't going to be the time. And so we pulled all of the Good Talk resources. But what was so fascinating and felt really rewarding, and Kate and I have talked a lot over the past sort of several weeks, is that we were able to go straight back to that research and pull the language that we thought was sort of most applicable to now. So we sort of turned it around, pulled all the good talk, and then put out a lot of that same language that tested really well. And again, it sort of mirrors a lot of what Kate was saying. The one kind of concept that tested really well across segments was this idea of control. You can't control a lot of things, but you can control who speaks for you and what they know. And that seemed just incredibly important right now because, you know, toilet paper panic buying is really people like reaching for some sense of control. There's a lot that we cannot control. There's a lot of ways that we see behaviors. People are sort of trying to do that. And a lot of people reaching out towards advanced care planning, I think, is that feeling of wanting to gain some sense of control in this world that feels turned upside down, filled with uncertainty. That being said, I would say if there's one thing I want you to take away, and I'm going to walk you through these segments again in the new lens of COVID, is that there are people who are going to hear our calls for advanced care planning through a lens of fear, distrust, anxiety, worry about rationed care, worry about denied care, really previous bad experiences with the healthcare system that the news media is essentially reinforcing on a daily basis. And so it's not that we shouldn't go out there and support people, because the urge for advanced care planning, I think, is really high, and it's like fantastic that we can turn around and offer people that support, but just sort of keep in mind that these different people are going to hear these different calls in really different ways. I'm going to give you, for example, our worried action takers, which is a really interesting segment. It's 10% of the people. They are people who've actually done advanced care planning. They've done either a living will or advance directive and have a medical decision maker. About 50% of them self-identified as a person saying that they had a disability. And when we ask them, and we don't usually show this data because it's a false dichotomy between quantity and quality of life, but this segment said overwhelmingly that they would prefer quantity of life over quality. And this sort of tracks a lot. What you're hearing is that people from the disability community, again, this is sort of about half of people saying identifying with having a disability. We're sort of hearing people sort of that they might actually be going back to their advance directives to say, I do want higher levels of care. So we can't make an assumption about what people are actually kind of going to be filling in their advance directives and how they're interpreting the sort of current situation, the current COVID pandemic. I would say our self-assured action takers, those are the people who have done their advanced care plans, and maybe they're the ones really looking at those again. There's older, kind of married, more likely to be higher income and higher education. Our disengaged warriors, this was a group of people, it's our largest group of people. They were the ones that when you ask them all the different reasons why they may not have engaged in advanced care planning, are more likely to basically just be so overwhelmed by it. Even though they were young, they were likely to say that they were in poor health, really didn't understand how to navigate the healthcare system or manage their health. And it was sort of when you looked at all the answers and put it all together, they were just really, really overwhelmed and anxious by this whole idea. And so we just need to be sensitive and kind of, again, going back to that language that tested well across all of these segments, which was about this condition control. Our confident independence, I feel like those are the group of people who are finally like, you know, I don't really need it. It's not on the list. Maybe now it really should be. And then our last segment are people who sort of like, oh, I really should do this, but you know what? I just really don't trust the healthcare system. That seems to be the sort of overriding thing. Again, it's sort of, you have to think about the ways in which people are going to be hearing, are you asking me to do this just so you're going to deny me care? So I think it's just really important when we're doing that to remember that not the people who are coming to you are probably in that self-assured action taker or confident independent, like they're open to this, they want that sort of feeling of control. Our worried action takers are probably more worried than ever before. And our disengaged warriors and our self-reliant skeptics might be really kind of scared and turned off by some of the messages that to do advanced care planning if it is not sort of mindfully done, again, with that recognition that we cannot control a lot of what is going to happen right now. And frankly, in this particular pandemic, we can probably control less than we ever could before. But we still can control who speaks for us and what they know. And that's why I think like the tools that are available are fantastic. So that's really my kind of overwhelming hot take in all of this. And I will stop talking now.
That's great, Anna. We have some tools that the coalition helped put together for folks on public messaging resources. So we can put the link to the website here, but this is available to anyone. Sample Facebook posts, Twitter posts, images that are already lined up that help match that similar idea of picking your person, having a conversation with them, stay home, wash your hands, all of that. So we will put the link to that in the in the chat.
Yeah, and I think the other thing to just sort of say what kind of reinforcing what Kate said at the beginning and then is that this whole idea of recognizing that a lot of people, especially those disengaged warriors, are probably going to have, even if advanced care planning has gone up the list, they're probably going to have 10 or 15 things, income security, sort of food, just like dealing with like a lot of sort of stuff going on that is going to still be higher on that list.
That's great. Thank you. With that, we want to turn it over to Marisette to see kind of what's your take? What are you seeing in South Carolina? How is this resonating? What messaging tips you have for others as they're thinking about this?
Wow. Once again, I'm always in awe when I sit down and I hear you guys. I've been curiously taking notes while Anna's been talking. And from South Carolina, and one of the things that we've been hearing, and let me back up a minute. We have a coalition called the South Carolina Coalition for the Care for the Seriously Ill. And with our coalition, one of our large initiatives where we were funded by Blue Cross Blue Shield South Carolina, we were able to do an advanced care planning initiative. And I'm so glad that we were able to get this done. 2 years ago, we started. And over the last 2 years, there's been more than 11,000 individuals in underserved and African American communities who've been educated about the value of having advanced care planning conversations. And in addition to that, about 1,200 clinicians. So our focus has been to really not only deal with consumers, but also to deal with clinicians. Our hospice association is the fiscal agent for the coalition, so we serve as a backbone for that. So sometimes the two seem like they're very, very entwined in terms of the work that we are doing. And during this time, we've been really pushing out, number one, clinicians and community outreach workers. You aren't able to get out like you thought you were going to be able to get out. But what you can do is that you can model what the behavior needs to look like. If folks are isolated, use virtual means to encourage them to use this time to have conversations with their family. I personally took the challenge this year to talk with my sisters about what I might want. And I've talked with them before, and so when I brought the conversation up again a couple weeks ago, they were like, why is it you always want to be talking about this? I said, well, it's important, and not only do I want to talk about it, but I also want you, sisters, to do something about it. Don't just have me working on my plans, and you aren't working on your plans. So I gave them each a copy of the South Carolina Healthcare Power of Attorney form and began to say, hey, this is our time. Now, this was probably right before our governor sort of shut down last week and said, everybody stay home unless you're working or one of these essential individuals. So it's probably about 3 weeks ago. And I thought that was, it was key, even though I'd had conversations with them before. But in addition to that, we have been putting a little bit of peer pressure on our colleagues, where hospice and palliative care workers, the statistics nationally are that we are always the ones who are really wanting people to have their plans in order, nurses and physicians and social workers and chaplains. But when you look at the statistics and the research, it shows that only 40% of hospice professionals really actually execute an advanced directive. So in all of the things that we are doing and things that that's on the website, we're encouraging people to take the pledge, to think about it, talk about it, write it down. We're encouraging them in any kind of virtual education. We're polling people to see how many of you are comfortable and how many of you have done this. Even this morning, we had a virtual post-training this morning. We're a little bit behind in terms of getting post statewide, and so we finally got it done, and now the form is available, so we were rolling out some education. And we had about 50 people on a call this morning. We polled the group, and it was just like the national. 40% said, yes, I've done it, and 40% said, no, I haven't done it. 52% said, yes, we've gotten it in hand. So there's room for us to lead from the front. And I think the other message that's important from a coalition perspective is that we really encourage collaboration and partnerships. We are working with our hospital association, the medical association, on all of these issues so that we can all be working together to help our communities. And as we are at the table trying to put together plans for surge planning and looking at where we can put patients, how do we need to get PPE, those things that are really affecting our workers to get to families. We're talking about how can we be innovative in really still supporting families, working with faith communities. So community partnerships are key, encouraging people to have their conversations while they're at home with their loved ones and they can't get out, can't go anywhere, to take that time to embrace having those meaningful conversations. And they don't have to be morbid. You know, they can be upbeat. They don't have to be, doom and gloom. But it's important for us to take steps to doing that. So I'll pause there, and those are my thoughts about what we have been working from two fronts, the clinical perspective and the community perspective. And I'll hush and let some others share.
I love hearing those examples and seeing in chat the mix of people who are doing similar to you. They're trying to reach the public and providers. And the NHDD has often been used to reach employees of whatever company it was, brown bag lunches, this idea of exemplifying or walking the walk, and let's all do it ourselves. And I think right now to recognize that that's both appropriate and to be super, super gentle, that there is so much stress befalling our healthcare workers right now, and talk about that lack of control or concern of kind of what am I walking into every day? What am I bringing home to my family? For some people, this might feel like a really wonderful tool. Yes, I want to think about this. I want this in order. And for others, it just might tip them over the edge of the ability to cope. And so being kind of flexible with that. And I love your talk about the collaboration and partnership and kind of united front with the other statewide associations so that there's not messaging flying across each other or contradicting each other. So it's a really great example.
One other thing I would share, Kate, is that we are in the very early stages of sort of working on an ethical perspective with diverse stakeholders. And part of that, looking at how we do communication, because as you talk about the lens that people are going to hear the messaging from, there are some communities who would feel like, when you're talking about resource allocations, that I'm automatically going to be at the bottom of that list. They're not going to, they're going to count me out. And so we realize that there's a great need to ensure that the message is balanced and that it does not take away hope in terms of what needs to happen. And so we are working with a group of diverse stakeholders that are looking at how can we put some messaging that's sensitive in place and making sure that everyone is singing off the same sheet of music. So it's very, very important. So more to come on that as we're working on this pandemic ethics work group. And I'll be happy to share as we kind of get through the process.
Thank you. So Nathan, maybe as the Wizard of Oz behind the NHDD curtain and ethics person and legal background and all that, just kind of what's your take and thoughts for those who've been doing this advanced care planning work in their community?
Well, first and foremost, just an unbelievably huge thank you. I can't give you thanks enough to not only the folks that are participating here, the folks that were planning to participate, and I can only imagine how they've been derailed in their crazy schedules, and obviously Conversation Project for all that you do to support NHDD. It's, as I've said gazillion times before, this is grassroots. It doesn't happen without this kind of engagement, and I cannot possibly thank you enough. I'm going to try and focus on some really high-level stuff, as that's my role as the leader of all this thing. So first and foremost, I want to point out that this is a huge opportunity for us. Obviously, we have always promoted National Healthcare Decisions Day is a single day, but we've been very flexible about it. Others have taken it and bumped it up to a week. We've actually tried the week thing. Others have bumped it up to an entire month. It is a year-round thing. And so one of the things we want to be sure is we're taking from this situation what tools we can to remind people how important this is and that this isn't a flash in the pan. We've been here for 12 years and many of us way longer than that. It's funny, I'm sort of, I've been joking with some of my friends, but there's some truth to it that there's a huge part of me that sort of wants to run around and scream like my teenage daughter might, I told you so, I told you so. But what I'm trying to do is show grace, just like I would do or try to do with my teenage daughter. And instead of saying, we told you so, we told you so, this is the time to try and say, yes, we have said this before. Now I hope you understand why it matters. And so hopefully with the context being what it is, people will come around and be more engaged. A couple other just really big things. It's 2020, right? So that one of the themes that we had coming into this was this notion of harnessing the 2020 concept, and don't look back with 2020 hindsight and regret the things that you did by failing to plan. And we're seeing that across the board. So I think that's another opportunity we have to use just the happenstance of 2020 being the year that we're in, and this don't look back and be regretting. Specifically relative to that, I'm also happy to tell you, I mentioned this to a few folks already, but because of the fact that National Healthcare Decisions Day has always followed Tax Day, we get a do-over. So we're going to do another National Healthcare Decisions Day on July 16, or if Congress or the President decides to bump Tax Day even further, we'll do it the day after, whenever that is. But I do not suggest this by any means as an indication that you should back off on the things that you got for April 16. But for us, it's a wonderful opportunity to do it again. So I hope that you'll take advantage of that. When you're doing your initiatives, however it is that you do them, please remind folks that we are not just talking about end-of-life stuff. This is about choosing an agent. Hopefully people going on a ventilator are going to come out on the other side. I take it from a triage perspective that the single most important thing I want to know is who's your decision maker. One of the sad realities of this situation is that we've seen domestic violence numbers spike to the degree that that's your situation or you have a loved one in that situation. You need to really think about who the decision maker is going to be. And you might be wanting to name someone who is not your spouse if that happens to be the source of abuse. Similarly, mental health, psychiatric advance directives. This is a huge point of stress on the entire planet, frankly, and it is already showing to spike some of the mental health challenges. And so for folks that are prone to that or have those conditions to the degree that they've got instructions to provide, we absolutely want them. So it's not just end-of-life decision-making, and we want to make sure that people are aware of that. And I guess the last thing I'll mention from a high-level perspective is I hope that we can learn from this from a legislative perspective. And I would encourage you to look at what your state laws are and see whether there's a possibility to gain some advantage from this situation, and specifically those states that still require advance directives to be notarized and things like that. Yeah. It's impossible when the courts are closed and the banks are closed, but we want to encourage people to do this. So think about where we can go next. Engage me. I'd love to help you in any way that I can. And just thank you again for all you're doing to support this initiative.
Kate, can I just sort of comment just like a little bit about what does this mean? There's sort of now versus future. And I think like Nathan, that's like such a great observation of like trying to use that. Like there are standards that we're applying to advanced directives that we really don't apply to other sort of comparably important documents. But I would sort of say there's a lot of what our research kind of found as we're trying to think about ways to get people more engaged in advanced care planning in like a normal baseline was that one of the reasons why they do it are sort of twofold. One, that it feels like, I mean, you know, it was different by segment, but one of the things that carries through is this idea that's like a little bit too hypothetical, and or it's about death and dying and I'm sort of young and healthy or I kind of don't want to go there. this being like seeing all of this uptick in an emergency situation, like reinforces some of the reasons why people didn't engage in advanced care planning to begin with, right? So it's this like double-edged sword of it's amazing that people really understand why it's important, but at the end of it, they'll think that it just has to do with emergencies and pandemics, as opposed to something that's really about opening up different lines of communication with your family and with your clinicians that are there all the time and long term. Because if everybody sort of waits to do this until it's pretty obvious that you're at the end of your life, or right now when we feel like we are all at risk of dying, then most of the time we're going to miss that opportunity unless it's really clear that there's like a global pandemic that might take us all down, because we still don't really understand why some people get it really severely or others don't. So I think it's like, again, and I feel like I'm like, you know, the Larry David of this call for whatever reason, just sort of reminding people there are opportunities that we also have to see through the lens of how different people are going to think about this and how it's going to reinforce certain pre-existing biases that might not be beneficial, like, you know, on a forward basis. That doesn't mean we shouldn't be doing absolutely every single thing we're talking about, because, and I'm going to slip in my Frozen 2 reference because I watch a lot of Frozen 2, is it like we have to do the next right thing. And the next right thing is to help every single person engage in advanced care planning in whatever way makes them feel better and actually helps them. But being mindful of A, how they're going to hear those messages, and we don't want it to harm any of their mental health or anxiety, and B, just sort of reminding us that this moment will pass and what we carry with it is going to be important.
That's great, thank you. Patti, I know you have some examples to share, and just thank you to all three of you for your kind of hot takes on what you're seeing, what's going on, and the chat is so full as well of what people are up to. So Patti, why don't you take it away?
Yeah, thank you all so much. And if you guys have any specific questions for Anna and Marisette and Nathan, feel free to pop that in. If you want to talk a little bit about what you're doing, go ahead and raise your hand. I'm going to share some examples and I'll pull some people in. I'm really loving the chat. So there's also a lot of connections already being made. Donna was asking about if folks have experience with group work. So if we're planning on doing a workshop and walking through a conversation starter kit or other tools, how, and if people are doing that through webinars or through Facebook. And so we're seeing connections already. I see Garrick is planning on doing an advanced care planning weekly group on that. So I'm excited. Tina, you mentioned you're doing a Facebook Live event. I know Nina Tiger's doing that as well. So let me just share a few slides on what we're seeing, and then I'm going to pull you all in. Keep chatting across the way in the chat. One thing I see that's coming up, and I'll go to Katie also if she has anything I'm missing. Folks are talking about how do we get witnesses signed, how do we provide things when we're so remote and physical distancing is happening. We know that CAKE, if you all aren't familiar with CAKE, it's on the resource list that Kate sent a link to before. CAKE is a fantastic website, and they now have on there, and jump in if anybody knows other sites, a decision maker, forgetting the title of it, but basically a decision maker guide that does not require signatures. Anna, you may know more about that, but I think folks can probably check out.
in the chat. She's already put the things in. So she's on. We got the way ahead of me.
Okay, so good. I've condensed my chat to see if any participants are raising their hand. Anna, did you want to say something about that?
No, I was just going to say it's sort of like it's very much along the lines of like having a document that lays this out and is signed. It's not like legally binding, but it's still, you lay out the person and you're giving information. It's sort of better than, and it's like more structured. So but I think the other thing is, I keep on asking this of my kind of clinician folks, it's that at the end of the day, when people are really struggling with proxies specifically, it's not that they're struggling like they just want to know who's the right person to call. And so it's very unlikely that, and kind of going back to Kate's reference, like if you designate your decision maker and tell everyone else in your orbit who that is, that's going to be what's most important in like 99.99% of things. Like things get really tricky, obviously, with complex family dynamics, but yeah, that is most of the game.
Absolutely.
And I would also say too that in communities, we're finding a lot of the banks, even though they're doing drive-through, they will do have people come inside by appointment. And so many of them have notaries. So if you're in a state that requires a notary, then your local banker is a resource for you. You know, that could be a reason to make an appointment to go inside the bank. So that is something that we're finding with some of the larger ones, your Wells Fargos, those big ones like that. Now, even your small ones would probably have someone who's a notary. And then if you need unrelated witnesses, they have a couple of people in there that could also help as well. So.
All right, so
I love that.
Here's the lawyer in me. Keep in mind too that these are extraordinary times. That all of the rules for advanced directives at the state level exist for the purposes of ensuring that there is a legally recognized document. That does not mean that other forms of information about your wishes, who you want as your decision maker, won't be and shouldn't be honored, particularly under the circumstances. So to the degree that you can take a selfie video and share it with your loved ones, please, by all means, go ahead and do stuff like that. Please don't think that you should do nothing because you can't get to a notary in a state that requires a notary. Take any action you possibly can. And frankly, if and when I get these kinds of questions for hospital clients, I'm going to tell them to take that stuff, and I'll help them on the back end if there's anybody who's sued. That's just not going to happen.
Yeah. And I'm seeing some of those examples in chat people are sharing. What I love is, Marissa, you mentioned this before, collaborate with those groups that are doing stuff already in your area. So there's a lot of really innovative work that's happening because there's so many groups that are trying to work together. And I loved that example. Let me just share a few examples that we have just from folks. And I'm going to pull in a few to just share a little bit about what they've been doing and seeing on kind of repurposing their message and NHDD. We had this up when Marissette was talking. This is an example from My Life, My Choices. What they did is send out a blast email to everybody to say, hey, we're still here. If you are, and I love the language on this, if you're quarantined, you might as well take part in healthcare decisions month. Here's how to get started. And clear steps and links within that on how do you have these conversations and how can you talk about that. So I just love simple email, right? Don't forget about that. Some other examples that we've seen, and I'm going to pull these two on the line if they're willing to share a little bit. In Colorado, so this on the left-hand side, Colorado is doing this big initiative with multiple partners and a lot of groups that are gathering together. The Conversation Project Boulder is putting together a whole series of events and connections on National Healthcare Decisions Day. In addition to, on the right-hand side, we have Your Decisions Matter up in New Jersey. Nina was chatting in before. Even before NHDD, Nina did a live chat with one of their reverends talking about end-of-life wishes, popped it on Facebook. It's a great 5-minute tops video, I believe, Nina, and it's short and sweet. And how do you engage your community? So those are two virtual opportunities. And so I'm going to actually see, Amanda, if you are, I'm going to see if I can do this. Amanda, would you like to share a little bit about what you've done, what you've seen on either re-messaging or things you're thinking about here for NHDD?
Sure. Can you hear me?
Yeah, good.
Hi. So this is Amanda Meyer. I'm the project coordinator for the Conversation Project in Boulder County. We had originally planned an in-person sort of NHDD Advanced Directive open house at our location, which of course has not going to happen. And so we decided to just go ahead and move that online. And we'll do it over 2 days, where the first one will be a live Zoom presentation about, the new tool that you guys created and how to use it to make some of your wishes known around specific COVID-19 questions. And that'll be about an hour long with chat questions available. And then the next day we'll have 20-minute appointments set up on Zoom or by telephone. And that's on a Sign Up Genius, where people can get one-on-one advice and direction from our conversation coaches throughout the day from like 8 a.m. to 6 p.m. So that's what we're planning to do.
Patty, you're muted.
I could just go on all day and chat, couldn't I? Thanks, Kate. Amanda, thank you. And we know you guys are doing really great work out there. I love sharing that you're doing double events, because in regular times, we know that bringing people back for a second or a third workshop really helps to kind of get that, let them sink in, let things sink in. So I love that you're doing events back to back. Nina, do you want to, can I see if Nina Can you hear me, Nina? And do you want to share a little bit about what you're thinking about doing for NHDD and some of the things you've already started doing to get your community engaged?
Sure. Can you hear me?
Yeah, absolutely. Go ahead.
Hi, hi, Patty. I'm Nina Tiger, and my organization is called Your Decisions Matter, and we're in Summit, New Jersey. And before this, all of our events were in-person workshops or different events. We had movie screenings set up. We had a hello game conversation cafe set up, and of course, all those things are not happening now. So we didn't have a very large Facebook presence or social media presence. So I've been trying to partner with other organizations that are bigger, just so people can be aware of us and get the word out. And so one of the things we decided to do was just try this. I interviewed one of our task force members. As you said, Patty, it was just a short 5-minute interview, but she gave some really great tips on how to have the conversation when we're all social distancing. She actually was talking about it might be even easier to have this conversation not face-to-face. She said when she talks to her constituents about something serious, she often will take a walk with them so they don't have to look her in the eye, which I thought was a really great tip and an interesting point because I had never thought about that. I just always thought it was much better to have this conversation when you're maybe holding someone's hand and looking them in the eye. So that was just a really good thing that came out of that. So we're planning to do that, having more one-on-one interviews. I mean, I have never done anything like this before. I don't even like people taking pictures of me on vacation. So it's crazy that I put myself up on Facebook doing an interview, but I mean, we've gotten such good response, and I think each one I do, it'll get better, hopefully. And then we're trying 2 other things. We're going to try to do a Zoom workshop with the families of residents of a long-term care facility. We haven't sent out the invitation yet. I'm just working on the logistics of it with our IT person. But I'm hoping that I guess we'll see how many people RSVP to see if we want it to be a workshop where everyone's participating or have it just be an informational webinar that people can just write questions on the side. And then in regular life, we had done a movie screening of the movie The Farewell. And we'd gotten about 70 people to come and see the movie, and then we had a panel discussion afterwards. So we're going to try that virtually. We're partnering with an organization called the Film Society of Summit. So we think by doing, and that movie, is available free on Amazon Prime. And then I think to rent it is $4, but it seems like a lot of people are already Amazon Prime members. So we're going to have people watch the movie on their own, and then we're going to do the panel talk at 7 o'clock at night, I think through Zoom webinar as of now. So we're just going to try those 3 things and see what happens.
I love it, Nina. And try, like, here's the time. I love, you said to me earlier too, the silver lining, it's forcing me to use technology that I'm just not comfortable yet with. And so I love that you're trying different things to see what's working, and coupling that with the messaging that Anna was talking about, how do we reach people in the right way for where they stand. You guys have good relationships within your community as well, so I appreciate it. Thank you for sharing. We only have 6 minutes left, but I'm going to pop this up. We've had some really good sharing in chat. Let us know, just continue to share, what are you seeing? What messages are resonating with folks now? And then what else are you doing, and how are you potentially repurposing NHDD right now? And maybe, as Nathan said, in July, think about things that you might do then. But let's stick with first things first. If folks are repurposing, let us know. Keep going in chat. I know we've got a lot of folks that are sharing already. But I'd love if there's anybody who wants to raise your hand and want to jump in. I'm just taking a peek at the attendees. I think I can see if they're raising hands. Let me know.
Hey, Patty, can you hear me?
Yeah.
Patty, can you hear me? I just want to remind people what they probably already know, but I have always encouraged almost shameless self-promotion during National Healthcare Decisions Day. because it ultimately benefits you at the end of the day, and it benefits the purpose of what we're doing. And I think now is a time when that matters more than ever. There's so much that has been disconnected. So to the degree that you can use this as a springboard or an excuse or an opportunity to reach out, not only in whatever your professional capacity and membership capacity is, but this is a time to reach out to family and friends, and just we're so disconnected. Use this excuse to reach out and show what you're doing.
Thanks, Nathan. And we've actually heard from several groups that Zoom, groups from Martha's Vineyard, from the East Coast to the West Coast, Zoom connections actually you're reaching people that they haven't necessarily reached before. And so that's a big boon, I think. And a couple of people have told us that they want to continue doing this when we get back to speed. So let me go ahead and share, given the last couple of minutes, just share some resources on how to keep connected. We're going to share the chat with everybody. The recording will be shared with everybody. And we'll make sure that you guys just keep popping in your examples in there. So here's what, one last thing we've seen, how people jumpstart this. We're still getting those questions. How do you get these going, right? And we were talking about this earlier. We have had a couple different people. I've done this. Some of our team members have done this. Shared a recent article. There's a lot in the news. And we know people have article fatigue potentially, but see what might resonate with a family member. There was this recent article in the New York Times about ventilators that I thought was a really thorough explanation and a really kind of good way for a non-clinical person to kind of absorb this. And so pairing that with, hey, I've read about this article, here's something I want to be prepared, here's what I've been thinking based on that, and use our new kit or whatever resources are out there. It's good to kind of pair what's in the news. If you have other ways that you've seen these conversations work and being jump-started and things that are really resonating, keep letting us know, because we want to share these ideas out. We are all about making sure that these ideas get shared either through social media, through our newsletters, and through our Facebook discussion group. So just please keep connected with us. Let us know what's working and what's not. We put that Facebook discussion group link in the chat before, so you'll see that up there. If you aren't already on our monthly newsletter list, we've now been doing weekly newsletter lists because there's so much going on out there. We want to keep connected with you all. This is a link to get signed up for that. So please, we'd love for you to join that so we can share resources and highlight the work that you all have been doing in those newsletters. Another way, on our Get Involved page, so on our website, we have a Get Involved button. If you scroll down on the button, we've got a map that folks are putting their pins on. If you're new to the Conversation Project, I encourage you to take a look at that. And you can, if you click on a pin, you can see who's doing what where. We have a lot more champions working on this than just that map, but it's a good start to see who's in your neck of the woods. If you haven't added your pin and you're working on spreading the importance of conversations, please, we encourage you to do that. So it's a really good way to network with folks. The last thing that we're doing to really help engage and learn, we have a quarterly survey that we've done. We were debating, is this the time to send this out or not? But we really feel that you all have been doing such phenomenal work. Our survey is out there. We want to thank you, those who are able to put the time in to do that. We tried to make it real short this month. Right now, if you can share some of your learning from January, February, and March and what you had done in those 3 months, please do so. We encourage you to share that way. We share that with others so we get the word out on all the good work that you're doing. The last opportunity I want to flag, and we'll send this, we'll have a post-call send out. This will be in there. There's a call that's coming up that IHI is hosting. They have a Pursuing Equity team on COVID-19 and equity. That should be a really good call. I know I'm really excited to go to that. So we'll send information out. That is on April 15th from 1 to 2. And I know there was a lot of calls going on, but I would recommend you take a peek at that. I'm going to wrap this up. I want to thank the John A. Hartford Foundation. They're the ones that are funding us, along with our original sponsor, Cambia Health Foundation. We are going to ask you, as we always do, share a little bit of feedback with us. So when you exit this, you'll be redirected to a survey. We know some of you are hopping on to another call. Keep that up, and after you're done with that call, you can share some feedback on this call to see if this was worthwhile for you. I do want to thank everybody, all that have been contributing in the chat. I want to thank Anna, Marisette, Nathan. Our whole team is really grateful for everybody here that's taken the time. Kate, is there anything else that you want to say before we bid adieu?
No, I appreciate that this call can go from us like chit-chatting at the beginning about our glasses from childhood into this, and I already see like 25 of you are trying to join the Facebook group, so I'm just so excited to see the energy that people have for this really important work and how we can take this terrible time and turn it into an opportune time to really engage more people. So thank you so much, everybody.
Great. Thank you, everybody. And thanks to our team, and keep connected with us. And with that, we end, and we will see you on our next call and through our Facebook discussion group.